Do psychiatrists actually help? Do they only prescribe medications? Well, let's take a look. So over the past couple of years, the interest in mental health has been growing because a lot of us have been struggling with anxiety or sleep issues and stress. So there's this burgeoning interest in psychiatry and psychology and mental health as a field. So in this video, we're going to look at a new wave in mental health, which is called integrative psychiatry. If you want to learn how to improve your mental health, then go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and I'm also the founder of Pacific Integrative Psychiatry, which is an online integrative mental health practice in California. Before we jump into the video, I'd like to invite you to sign up for my free holistic mental health mini course, which is all about natural ways to overcome anxiety and sleep issues. So the link to the course is shown on the screen here and also is in the video description under this video. This is episode 1 on understanding integrative psychiatry. So let's talk about that. Like, what is integrative psychiatry anyway, and how is it different from regular psychiatry? Well, I'll just preface this by saying that psychiatrists are medical doctors, so they're different from psychologists, who are usually PhDs or PsyDs, or therapists who have other types of training. So psychiatrists are medical doctors. We went to medical school, and then we did additional specialty training in psychiatry. And our training is all about understanding the medical underpinnings of mental health. Sometimes we help people with medications, or we help people get off medications. So the difference is, though, with integrative psychiatry, it really takes a whole body approach. In conventional psychiatry, the approach is usually to match up a medication with a person's symptoms. And that can be helpful in many cases, just to kind of quiet things down so people can function better. But integrative psychiatry takes things a step further. Whereas in conventional psychiatry, we're asking, what are your symptoms? An integrative psychiatrist is thinking, what are your symptoms telling us? And what else do we need to be looking at? So the integrative psychiatry approach is really a whole body approach. So we're taking into account everything that could be affecting, let's say, anxiety or sleep issues, for example. So this includes things like gut health, like your nutritional levels, your micronutrient levels. It can include your sleep. I'm a sleep doctor, so I like to look at sleep quality and if there are any sleep disorders that could be contributing to mental health and vice versa. Integrative psychiatry also includes other types of therapies, from yoga or Ayurveda or traditional Chinese medicine. It brings in elements of mindfulness and meditation and acupuncture. So it really encompasses all of these traditional healing systems that are really, really restorative to the body. So integrative psychiatry does not reject conventional psychiatric approaches. Integrative psychiatrists like myself may use medications when appropriate. We also specialize in helping people get off medications when appropriate, but we also bring in these other healing modalities. And what's really interesting about this is that it's not a brand new approach. This is actually a very ancient approach to health and healing, because a lot of these traditions come from ancient systems of healing, like Ayurveda, which is the system of healing from India that is like 5,000 years old, or traditional Chinese medicine. So it's kind of like what's old is new again. And we're seeing that the modern science and research is actually catching up with these old practices. And we're learning more and more about how these practices are actually very healing and restorative and are evidence-based. In my practice, we also have a functional nutritionist. So she helps people with the gut-brain axis. And again, this is another really exciting area of research where we're learning more about the microbiome and how the composition of your gut microbiome affects mental health. And there's a constant communication between the gut and the brain. So the functional nutritionist in our practice helps people kind of restore their gut in order to help improve their mental health and their sleep. One thing I think is wonderful about integrative psychiatry is that you can talk about this stuff. You can talk about the gut, you can talk about nutrition and supplements, and your integrative psychiatrist will know what you're talking about, because we're actually not trained in a lot of that stuff during conventional psychiatric residency. So integrative psychiatrists have done more training on these things, or maybe have their own personal experiences with it that led them to bring these practices into their their treatment protocols and their approach with patients. So you don't have to worry about sounding woo if you're seeing an energy healer, or you're doing Reiki, or you're looking at doing Kriya practices that help to enhance your body's energy system. You don't have to worry about sounding crazy with your integrative psychiatrist, because we get that language. We sort of understand what you're talking about, and we may even practice some of those things ourselves, but we also take a very holistic and science-based view. So you're kind of getting the best of both worlds, where you're getting someone who understands conventional medicine and medications, and also these other aspects of healing. All right, so if this type of information is helpful for you, then go ahead and click the like button. So who should be seeing an integrative psychiatrist? Well, maybe I'm a bit biased because I am one, so I think everyone can benefit from this type of an approach. But it's really for people who want to bring in the best of both worlds, who want to understand how to use conventional therapies. They want to know, are medications right for me? Are there other things that I can be doing to get over anxiety, to help improve my depression, to help overcome sleep issues? So it's really for people who want to truly optimize their mental health. Integrative psychiatry is also great for people who are tired of the conventional approach, where they go and see their doctor for 15 minutes and they leave with a prescription and not much else. So that's where integrative psychiatry can come in, and we can help figure out what else you can do to feel better, and to really not just feel better, but to really thrive and optimize your well-being. Integrative psychiatry is all about developing a partnership with your clinicians, whether it's your integrative psychiatrist or your functional nutritionist. Will help guide you through a personal plan that is going to work for you and for your lifestyle, and it's going to help you figure out what's actually going on with your body, because we're all so different. We all have different individual needs, and this is the beauty of that holistic approach, where we can start to do testing and kind of look under the hood to see what else is going on, so that you can achieve long-lasting improvements in wellness. Okay, so that was a quick overview of what an integrative psychiatrist does. In the next episode, we are going to look at what happens during your first appointment with an integrative psychiatrist. Have you ever seen an integrative psychiatrist? Go ahead and let us know in the comments below.